commentary on issues that are impacting the trans and trans-adjacent community. On almost every day of the week, I drop some form of news that, has been published within the preceding week, and we talk about some of the issues that means for the trans and trans-adjacent community. Today, I'm actually looking at something a little more focused, and I'm looking at the discussion that seems to be arising around the overlap of autism and transgender experience. So this morning what I did was I went back and I showed the historical part of the discussion of the overlap of the core or the co-occurrence of autism and transgender experience, gender diversity. Autistic spectrum disorder and gender dysphoria have been identified for about 8 or 9 years within the lives of children, adolescents, and adults, meaning that people who have gender dysphoria also tend to show an elevated chance of autistic traits. Now, either one of them can be undiagnosed, but the overlap of these two is very much a matter of seeing that one diagnosis and the other diagnosis does seem to be prevalent within a larger number of transgender people than in cisgender people, meaning that, of course, cisgender people are not going to be diagnosed as gender dysphoric, but those traits that would lead one to gender dysphoric experiences don't seem to be as prevalent. And autistic traits cannot be identified as much in cisgendered individuals as they are in transgender individuals. So we are definitely going to be, we're looking at this overlap, this co-occurrence of gender dysphoria and autistic spectrum disorder. Now, as I said, we've known about this for almost a decade, but within the last few weeks, politicians have been jumping at the bit to use the discussion of the co-occurrence of gender dysphoria and autistic spectrum disorder, or gender dysphoric traits and autistic traits, to begin to create an even more strict form of barrier to gender affirming care. Beginning with a bill from Georgia. Georgia's bill stated that there's been a massive unexplained rise in diagnoses of gender dysphoria among children over the past 10 years, with most of those experiencing this phenomenon being girls. Gender dysphoria is often comorbid with other mental health and developmental conditions, including autism spectrum disorder. The issue with that statement is that science and mental health professionals do not consider autism and gender dysphoria to be comorbidities. There is a co-occurrence. They are separate experiences of neurodiversity. And now, politicians, as a way of finding an effort to create a barrier to gender-affirming care, are beginning to look at these and mislabel them as comorbidity. The Attorney General in Missouri created an emergency order that basically establishes that before anyone can access gender-affirming care, they have to have a full screening for autism, and any mental health, any existing mental health comorbidities of the patient must have been treated and resolved. Also, Ohio has just issued a bill that states that no mental health professional shall diagnose or treat a minor individual who presents for the diagnosis or treatment of gender-related condition without first doing both of the following. First is gaining the consent of the parent or legal guardians. But secondly, there must be a screening of the minor individual for both other comorbidities that may be influencing the minor individual's condition, including depression, anxiety, attention deficit hyperactivity disorder, autism spectrum disorder, and other mental health conditions, and physical, sexual, mental, and emotional abuse and other traumas. Meaning that gender-affirming care, a diagnosis of gender dysphoria, cannot be granted until there has been a screening for all other mental health issues and a screening or a complete history of physical, sexual, mental, or emotional abuse. Now, first of all, mental health professionals have dismissed and disregarded trauma as some form of impetus for gender dysphoria. It is also not a comorbidity of autism. The idea of holding on to this concept that neurodiversity is is a result of trauma, no matter what form of that trauma might be. Neurodiversity has been completely disconnected from traumatic past events, in the sense of neurodiversity related to ADHD or autism or even transgender experience, gender dysphoria. So to screen for those traumas already shows that in Ohio, they are not looking at the most recent standards for mental health and psychiatric care. They are going back 2 and 3 different editions of the DSM to find identity issues, gender identity disorder, as well as transsexualism. Both of those had attachments to trauma as a possible indicator of eventual gender dysphoria. But those have been dismissed, especially since they changed over to gender dysphoria and depathologized transgender experience. Under transsexualism, under gender identity disorder, both of those were pathological, and they were treated as such, as if they were something that needed to be cured. Mental health professionals have moved past that. They now see gender dysphoria as the distress that is caused by an incongruence in one's gender identity. And that's all it is. There is no pathology around that. It's just this distress that is basically, rising up out of this incongruence. So Ohio is using outdated background material to create barriers to access of gender-affirming care. Now, this is where, that was the review. Here's the implication of it. Within the history of mental health and politics, there has been an observation of something called punitive psychiatry. The idea that psychiatric diagnoses are used in a way to create a punishment on people. Meaning that people will use a psychiatric diagnosis and somehow use that against an individual in such a way that they become, victims of involuntary incarceration, that they are put under psychiatric observation without any due process, that they are taken into, some form of custody so that they can be evaluated or removed from a The Russians would look at a political dissident and they would begin to use language of this individual is mentally ill, this person is somehow disturbed, this person is out of bounds of normalcy. And the Soviet government would take those dissidents, people who are, were very outspoken against the Soviet Union and the Soviet government. They would take those individuals and put them into camps, gulags. They would put them into these, essentially they were, labor camps, or they would put them within a psychiatric hospital and they would keep them there. Under no pretense of true mental illness, just because they were dissidents against the government at that time. When we begin to look at, the history around the world, there are clear evidence of these events taking place. And as we look at other countries, we cannot excuse the United States. The history of the United States in punitive psychiatry can be documented in a number of different events that have taken place. Back in 1851, a physician named Samuel Cartwright created and coined the mental illness drapetomania. According to Cartwright, drapetomania was a mental illness that caused black slaves to flee captivity. Cartwright also created a cure, a remedy. His feeling was that with proper medical advice strictly followed, the troublesome practice of black slaves running away can be almost entirely prevented. That remedy was, according to Cartwright, whipping the devil out of them as a preventative measure. As a remedy for this disease, doctors were also using the procedure of removing the big toes of individuals to prevent their running away. Cartwright also proposed dysesthesia athopica, which was a mental illness that he described as causing laziness among slaves. Clement W. King Jr. was an African-American pastor and activist in the civil rights movement. Mr. King attempted to enroll in the University of Mississippi, Ole Miss. At that time, Ole Miss was a whites-only college. Mr. King was enrolling for summer graduate courses. He wasn't even enrolling for an undergraduate program. He was pursuing an advanced courses. This was in 1958. The Mississippi police arrested him on the grounds that, and this is a quote, any insular who tried to enter Ole Miss must be crazy. For 48 hours, no one knew where Mr. King was. It was eventually revealed that Mississippi authorities had kept him confined to a mental hospital for 12 days to evaluate his sanity. In 1964, the election, in which one of the candidates was Barry Goldwater, a magazine polled the American Psychiatric Association on whether candidate Barry Goldwater was fit to be president, and then published The unconscious of a conservative, a special issue on the mind of Barry Goldwater. This led to the adoption of an ethical rule against diagnosis of public figures by a clinician who has not performed an examination or been authorized to release information by this patient. This became known as the Goldwater Rule. In the 1970s, Martha Beale Mitchell was the wife of U.S. Attorney General John Mitchell, and she was diagnosed with a paranoid mental disorder for claiming that the administration of President Richard M. Nixon was engaged in illegal activities. Many of the claims of Ms. Mitchell were later proved to be correct and substantiated, even to the point of President Nixon resigning from the office of president in light of criminal allegations. The term Martha Mitchell effect was coined to describe mental health misdiagnoses when accurate claims are dismissed as delusional. Within the United States, there is a history of punitive psychiatry. This is what we are looking at when we look at these bills that are using comorbidities such as anxiety or depression and the co-occurrence of autistic traits as a barrier to gender-affirming care. The possibility of making access to gender-affirming care impossible is very realistic. When we see bills that are misusing data and research from the mental health field, when we see bills and politicians using the older standards of a mental health program that have been dismissed and discontinued in practice, when we see them claiming those older methodologies, we are looking at punitive psychiatry raising its ugly head in modern times. The idea that there is something that prevents someone from functioning normally as a transgender person is trying to declare that there is a mental illness that cannot be cured because it doesn't exist. Therefore, you have to eliminate the comorbidities. You have to take care of the anxiety. You have to take care of the delusion. You have to take care of the autistic traits, and then the gender dysphoria will disappear. Now, in terms of the history of punitive psychiatry in reference to LGBT individuals, the history has been very clearly stated recently. All you have to do is go watch some of the documentaries that have been released on it. One of the most common forms of punitive psychiatry is the use of conversion camps, typically run by religious organizations or specifically Christian organizations, evangelical far-right Christian organizations. Conversion therapy can be either done in a office-type setting with a pastor or a Christian counselor, or they have been using a camp-type setting where they will send victims of the pathological experience of homosexuality or gender identity disorders and use that camp experience to reprogram those individuals so that they can continue on forming some type of normal life. Now, normal means meeting the standards of righteousness and holiness in many cases within a Christian understanding of sin and righteousness. Whereas a homosexual person or somebody with gender dysphoria who wants to live out that gender identity, they are sinners, and therefore they must be cured in order for them to have a full and holy life. Conversion camps use many forms of possible torture techniques to reroute the impulses. In many cases, what they would do is they would tie impulses related to homosexuality or gender identity and gender dysphoria to some sort of negative experience, meaning that there may be the inducement of vomiting, or there may be pain or therapy that would send electrical shock that would create a negative impulse. All of these methodologies were also used in clinical settings. They were used in psychiatric hospitals. They were used within professional settings to try and correct the behavior of homosexual individuals as well as transgender individuals or non-binary individuals. We know that a lot of this history of pathologizing homosexuality as well as gender identity has been only recently dealt with, meaning that up until the 1970s, there were still clinical settings that were using these techniques to try and correct the behaviors of homosexual individuals as well as transgender individuals. When the American Psychiatric Association removed a diagnosis of homosexuality from the second edition of the DSM, a new day of looking at queer people began. The theories that regarded adult homosexuality as a disease or an abnormality are typically grounded in biblical Western Christian ideas. It's very much built within the same ideas that people have been arguing that, the Bible says clearly that homosexuality is a sin. All of this abnormality, all of this pathologization of homosexuality was grounded in Western Christian understanding of a select group of verses within the Bible, New Testament and Old Testament. But that was taken to the clinical realm and saying that there's some form of abnormality in somebody who behaves this way. Also, there were ideas that there was, immaturity, some sort of intervention within the development of an individual that created this abnormal understanding of themselves, or this abnormal attraction to those of the same sex. Gender beliefs are the same way. Gender identities have also been treated on that same criteria. In the pursuit of trying to play to the Western Christian ideologies, anything that steps outside the norm of sex and gender are immediately deemed to be abnormal. For homosexuality, that included putting people into clinical settings such as psychiatric hospitals and performing many different types of negative behavior therapy methods to try and change the impulses to act. Electroshock therapy, the ideas of creating a sense of nausea around those ideas, even so far as to using lobotomies to correct these behaviors, to somehow deal with this abnormality within an individual. In 1973, the movement to depathologize homosexuality, which really began with the work of Alfred Kinsey and his study of American sexuality, ignited gay activists to try and fight for their rights in mental health care. And they succeeded in that. They finally were able to achieve that. And so in 1973, the APA depathologized homosexuality and removed it from the DSM as an abnormality. Now, at the same time, gender beliefs were still being looked at as an abnormality. Even up into the 1980s, where research was being done on transgender individuals, but the use of abusive techniques had been sidelined. The use of electroshock therapy, of negative impulse, and of lobotomies had been discontinued. Because in many ways at that time, transgender experience, gender identity experience, was somehow tied to homosexuality. They could not find a direct link, but there was just enough evidence to say, well, this is obviously some form of homosexuality, but it is more advanced than what we see in homosexuals. So they continued to look at it from a pathological perspective. Moving up through the 90s and into the 2000s, we finally begin to see the mental health community depathologize gender identity concerns. Moving from transsexualism in the early parts of the 70s and 80s, moving into the diagnosis of gender identity disorder, which treated it as a mental illness, until we saw the transformation of gender identity disorder into gender dysphoria. Why? Because under more closely analyzed interventions with transgender people, what we began to see is that as the community looked at it, these people are not mentally ill, they just experience a form of distress that causes them a little bit of incongruence in this area in their life. This one area of their life happens to be gender, and the treatment for that was transitioning to the degree of comfort achieved. Meaning that for transgender people, the treatment of gender dysphoria is not clinically set at a bar and it's like, okay, we're going to reach that bar. What was found is that not all transgender people experience an intense form of gender dysphoria. But there is an incongruence that they experience, and so they don't really need a lot of intervention. For others, there is a level of intervention that includes social transition, how they present themselves, what they call themselves. For still others, there are more intensive medical interventions such as hormone replacement therapy, and then surgical interventions for those who experience the most intense forms of gender dysphoria. And there are various levels even within that. For some individuals, gender dysphoria can be relieved with breast augmentation or breast removal. For some, there needs to be surgery so that their genitals align with their gender identity. For still others, they may look at feminizing or masculinizing facial features, dealing with the vocal cords, thinning them out for those who want a more feminine sounding voice, or using hormone replacement therapy in such a way so that it's directed and the voice deepens. looking at shoulders and shaving shoulders. These are more intensive forms of interventions that relieve dysphoria. Now, all of these have been approved under the supervision of multiple medical and mental health organizations. They have seen this as the ability to provide relief to transgender individuals. What we are looking at right now within the United States and places around the world is the backtracking of anti-trans groups that want to remove the advancements in care and treatment of transgender individuals, returning to an earlier time where diagnosis was more pathological and where conversion of a person from their beliefs in their gender identity to a standardized dichotomy of male, female, man, woman. The movement toward conversion therapy, which has been deemed to be ineffective as well as damaging by the modern medical and mental health communities. But the push back to conversion therapy is trying to undo the advances that we have made. And in the course of that movement backwards, we are getting closer and closer to the ability to look at involuntary incarceration of individuals deemed to be mentally unfit to function in society. We are looking at the use of punitive psychiatry that could expand to the point that we, the transgender community, the non-binary community, could have our dysphoria weaponized against us to the point that we could be involuntarily incarcerated. In 2021, the Texas Republican Party released their platform for 2022. The platform includes many conversations about how the Republican Party wanted to deal with the issues of gender identity. Give me 1 minute, y'all, so I can find this. There we go. Oh, that wasn't it. There we go. Oh, hush. What was it? One moment, I'm almost there. Okay, this is what the 2022 Republican Party platform said. We support enacting legislation in the state of Texas ensuring that no government entity in the state shall be allowed to define for any private business or private entity how it must segregate its restrooms, changing facilities, or showers. Yes, Autumn, you can. No government agency shall be allowed to require businesses to profess, espouse, or adopt specific views on sex, sexuality, gender, or gender identity. We oppose any attempt to criminalize or penalize anyone for the wrong use of pronouns. Government agencies must guarantee that views and positions on these matters are not used as a basis to deny access to public accommodations, as defined by the Civil Rights Act of 1964, nor to deny employment or discriminate in employment decisions solely on the basis of a person's views on these matters. We recognize that gender identity disorder is a genuine and extremely rare mental health condition, and that denial of an immutable gender binary not only denies those with the condition proper mental health care, but also leads to physically and psychologically abusive social transitioning, as well as irreversible physical mutilation. We urge the state legislature to pass legislation that requires adherence to sex identifications on all official documents that will be based upon biological gender, as well as legislation enacting civil penalties and fiscal compensation awarded to detransitioners who have received gender-affirming surgery as compensation for malpractice. There was one other point. Well, let's just go back to what that was saying. Now remember, this is Texas, and this was a year ago. The paragraph that they're dealing with here, we recognize that gender identity disorder, already in the very first line of that, they are going back to the previous designation of what transgender experience was diagnosed as. A pathological concern that needed to be treated and relieved. We recognize that gender identity disorder is a genuine and extremely rare mental health condition. That denial of an immutable gender binary not only denies those with the condition proper mental health care, but also leads to physically and psychologically abusive social transitioning, as well as irreversible physical mutilation. The Republican Party of Texas in 2022 wanted to eradicate gender-affirming care for all people. But not only that, they wanted to ensure the provisions of what they entitled proper mental health care. For a pathological mental health issue and a gender identity disorder, as well as not allowing for social transitioning. Now remember, we're talking about all people. We are not talking about adults or just children. This is all people. Texas wanted to make provisions to remove social transition, gender-affirming surgery, gender-affirming hormone care. They wanted to remove that from access, leaving conversion therapy as the only viable form of treatment for transgender individuals. Stop and ask yourself this. What do you do with an adult who does not want to be forced into a medical treatment plan? What do you do with an adult who is considered to be mentally ill and somehow incapable of making right and good decisions for themselves. How do you deal with an adult who is in some way deemed to be a threat to themselves? In most states, it's an involuntary hold order. In most states, if an adult is deemed to be in some way a threat to themselves, they are then placed on an involuntary psychiatric hold. Meaning that what Texas was moving toward was the idea that if a transgender person refused conversion therapy, insisted upon transition or gender affirming surgeries, they would be deemed a threat to themselves. Listen to the language, folks. It leads to physically and psychologically abusive social transitioning, as well as irreversible physical mutilation. Once again, this is not in reference to children. This is in reference to individual rights and freedoms. It is in a section of the Texas Republican platform highlighting data privacy rights, highlighting identity theft rights, highlighting religious freedom for businesses, highlighting religious freedom of speech and practice, but then a government policy that says that someone who is seeking social transition or surgical transition is putting themselves at a risk for harming themselves. As a government policy, what would you do with those kind of people? The history of punitive psychiatry shows us what they are moving toward. If conversion therapy is the only form of therapeutic methodology that they deem to be worthy, and you have an individual who does not want to go back to who they were, mandatory conversion therapy would be prescribed. This is where intersectionality comes into play. This is where the knowledge of history and politics and medicine comes into play. This is a path. This is a pathway that we have seen over and over and over again to removing individuals from a political scene. The Soviets did it. The civil rights movement was targeted. We have seen this happen in Nazi Germany. So when you hear transgender people talk about genocide, understand that what we are talking about is happening. We are just in the midst of it. We've already been classified. There's already a symbol associated with us. Discrimination is happening. Dehumanization is happening. Organization, polarization, preparation, and persecution are all present, and we have seen denial of this at every level of civil and public discourse. It's only to protect the children. We're not going to target anybody's civil rights. We're not going to target anybody's human rights. Extermination is the only quality of a genocide that we've not seen on a mass scale. But what we are seeing right now is very reminiscent of what we saw of Poland, Germany, Austria, Czechoslovakia in the 1930s. Individuals who identified themselves as Jewish people fleeing their lands of their ancestors to find safe harbor because they saw what was coming. And now we are watching transgender adults and the families of transgender youth leave their homes, their lives, to find safety in a different part of the country or a different part of the world. We are watching states roll back scientific and mental health medicine to the 1980s, if not the 1970s. And we are watching states create loopholes and gaps for conversion therapy. The next steps are going to look suspiciously like punitive psychiatry. The next steps are going to look like considering transgender people and non-binary people, people who experience gender dysphoria or people who do not experience gender dysphoria, who seek to social transition or more invasive medical interventions. They are going to be targeted and they are going to be removed against their will to be placed in holds for psychiatric evaluation, if not outright prescription into conversion therapy. You all can call this a conspiracy theory if you want. I don't really give a fuck. We know that the deniers are going to deny. We're going to be considered inflammatory or rhetorical because we are talking about genocide and we're talking about these things. But between Georgia, Missouri, and Ohio, we are seeing the rollout of punitive psychiatry to attack adults and minors for being transgender.